Catalano. He is the Bartley Dobb Professor for the Study and Prevention of Violence and the Director of the Social Development Research Group in the School of Social Work at the University of Washington. He is also an adjunct professor of education and sociology. For over 30 years, he has led research and program development to promote positive youth development and prevent problem behavior. His work has focused on discovering risk and protective factors for positive and problem behavior, designing and evaluating programs to address these factors using the knowledge to understand and improve prevention service systems in states and communities. He has published over 300 articles and book chapters. He is a senior advisor to Active Living Research, a program of the Robert Wood Johnson Foundation, and a member of the steering committee for the National Strategy for Behavioral Health Promotion. He has served as a member of the NIDA, which is part of NIH, Blue Ribbon Panel on Health Services Research, the Office of National Drug Control Policy Evaluation Committee, the U.S. Attorney General's Methamphetamine Task Force, Office of Juvenile Justice Delinquency Prevention Study Group on serious, chronic, and violent offenders, and the CSAP Prevention Enhancement Protocol for Family Programs. He is the program director of the Social Development Model, the parenting programs, guiding good choices, supporting school success, staying connected with your teen, and focus on families, the school-based program, Raising Healthy Children, and the community prevention approach, Communities That Care. And he's only 30.
For that introduction and reading every last word. It's very embarrassing to me. But I have to let you know that there's a few things that I'm not anymore, and that is that yesterday there's a new director of the Social Development Research Group, Kevin Haggerty, after 35 years in the associate or director's job of that research group. We've just passed the baton on to the next generation. So I'm very pleased about that. And I'd like to thank the organizers today for inviting me to come. I really share the mission and vision of our two congressmen, Scott and Cardenas, to use science to make a difference in the lives of children, families, and communities so that they thrive rather than become incarcerated. And I think that's really, really important. And as the president-elect of the Society for Prevention Research, we are partners. In that, we're partners with Denny and Neil, but we're also partners with Congress, as well as the Senate and communities across America to try to make an impact using science. So, as Denny said, I'm a professor in the School of Social Work, and along with David Hawkins, the founding director of the Social Development Research Group, and the new director, Kevin Haggerty, and our colleagues, we spent the last 35 or so years investigating predictors of positive and problem behavior, because we figured if we knew what the predictors of these problems were earlier in a child's life and could change them through developing and testing interventions, we could actually make a difference in those children's lives, those lives of youth as well. It was a great idea, and it actually has borne fruit over time. So we've developed and then tested preventive interventions that have actually made a difference long term. Sometimes our latest follow-up has age 30 first graders that we intervened with in 1981. At age 30, they're still showing, incredible differences compared to those who weren't intervened with. So we see that prevention is more than Ben Franklin said, or maybe is what Ben Franklin said, an ounce of prevention is worth a pound of cure. And finally, we've developed and tested tools to build capacity of states, communities, and schools to build prevention infrastructure, which was what I'm going to talk about today, to plan and implement appropriate evidence-based programs. If you could go to the first slide. I have 4 objectives today. Why should we care about prevention? I know that I'm speaking to an audience that this might be part of the choir, but I want to give you a few new reasons perhaps to care about prevention. What is the research base for prevention science? That's going to be one slide only. Denny did a great job of talking about that. And then I'm going to talk about why we should build prevention infrastructure and give you one example in Communities That Care, a program that we've developed and spent the last 20 years testing as well. So if you go to the next slide, there's been, because of the worldwide investment in infectious diseases, so we know what causes them and how to cure them, as well as a big investment in child health, more children are surviving into adolescence. Infant mortality rates are down worldwide. And there's been a shift from the major causes of death, from infectious diseases to non-communicable diseases. I don't know how many of you started hearing NCDs out there, but it's really the biggest driver of mortality and morbidity. And behavioral health problems of the kind that we're all talking about today, substance abuse, violence, and delinquency, and other kinds of problems, or really mental health problems, for instance, are implicated in this shift. If you go to the next slide, this is data. If you go to the next slide, thank you. This is data from the CDC, and if you do a single click, these are the leading causes of mortality for adolescents and young adults. And you can see that 72% of all deaths in this age group are due to behavioral health problems, whether it's risky driving and other accidents caused from alcohol or drug abuse, intentional self-harm, mental health problems, assault, violence, or teenage pregnancy. These are all behavioral health problems that are largely preventable. If you do one more click, now this is in the total U.S. population. We know that disadvantaged populations have this is even more true. This is also from the CDC looking at American Indian and Alaska Natives. And if you click one more time, you'll see here that it's 82% of all deaths are caused by these behavioral health problems. And just to do a little quick look at that, just to highlight two things. Suicide, intentional self-harm or suicide is double the risk in Alaska Native American Indian populations. And drug overdose and alcohol overdose first come as a primary cause in this group as well. One more click. And we just know that preventing these conditions and behavioral health problems are preventable. These problems cause health problems during adolescence, but also things like smoking, or that Bob was talking about earlier. Putting kids in jail, creates a lifetime of harm during their life because they haven't been able to develop in a positive way as a result of that incarceration. So it goes into young adulthood, and preventing these behavioral health problems during adolescence can really reduce morbidity and mortality over the life course. One more click. So should public systems, for example, juvenile justice and child welfare, care about community-based prevention? Is that something that they need to care about or not? Go to the next slide. This is data that we've collected in all 6th, 8th, 10th, and 12th graders in a medium-sized eastern city. There's about 5,000 kids overall. We've divided this chart into two groups. One, those exposed to 10 or more risk factors, those predictors that I talked to you about earlier for multiple problems. That's a lot of risk factors. Those kids have troubled lives in their family, in their schools, and in their communities. So I've divided it into two, if you click one more time, and we see, and also looked at foster care or juvenile justice, those two little thin slices at the top. Now I think about 7% of all kids are in those two clusters, and most of the kids in juvenile justice and foster care are at high risk. About 71% of them are at high risk. And in the general population, there's a smaller percentage that are at high risk. It's only 35%. But if you do one more click, But what that means overall for a community, not just a child, but for a community, because I'm talking about community health and prevention infrastructure, is that most of those high-risk kids aren't in juvenile justice and child welfare. In fact, they're outside. They're in the community. 87% of all the kids in this city are actually at very high risk for developing problems. So one more click. And what this means to me is that without effective prevention, this dam is going to break. 13% of those kids are getting through to the systems, but there's 87% behind them. We've got to, if you will, reduce the size of the community risk reservoir. Otherwise, not only will our programs be overwhelmed, but our kids aren't going to be developing in a healthy way. So if we go to the next slide, what do we know? As Denny said so well, have talked about, and we also, in the services research area, we understand how to build effective infrastructure and to use prevention science in communities to achieve impact. Go to the next slide, please. This is the tragedy of the 21st century. Despite all this progress, despite this knowledge base, prevention is, how can we build prevention infrastructure to increase the use of tested, effective prevention policies and programs with fidelity and impact at scale, so they're done right, as I think Bob was saying. If they're not done right, they're not that good for people. They can actually have iatrogenic effects when they're not done well. Click. While recognizing that communities are different from one another. My community is different than yours. In fact, where I live in my community, there's different parts of my community that are different than where I live in my community. So we really have to give communities and empower them and give them the capacity to decide what local policies and programs they want to put in place that are effective. Next slide, please. So a lot of people have been thinking that community coalitions are good ways to do things. How many people know about a community coalition in your area that you live in? Come on, you guys. We don't do it for everything, whether it's, environmental health, whether it's, solid waste disposal. There are all these kinds of community coalitions. Why for adolescent problems? Risk and protective factors are located in community, family, school, peer, and individual group. And they vary by neighborhood. Hey, a community coalition with people representing different areas would be really good to pull together. Second, click. Community coalitions, if you get them together, they have diverse representation. There's multiple sectors that can coordinate resources and actions across these different sectors. And multiple sector involvement means that you're likely to reach all the kids that need help. The last click is, unfortunately, not all these approaches are effective. If you go to the next slide, there are a number of effective approaches to community-based coalition preventive approaches. Abby Fagan, David Hawkins, and I did a summary article looking at the effective coalition processes. These first two are really focused around underage drinking. They have effects on those over 18, not those under, and they're mostly focused on community mobilization and laws. Next, click again. Here's two programs that work with community mobilization, but also have effective school-based programs that have been effective, and one more click. And these three, including Communities That Care, that I'll talk just a little bit more about before I stop, are using community mobilization, school-based programs, and community-based programs. And again, these 7 models have all been shown to be effective. Other research that's done on prevention infrastructure, click, also shows that it increases value, if you will. It increases understanding and knowledge of prevention science. All the speakers have talked about this information needs to get out. Not enough people know it. These prevention coalitions do that, building community capacity to use evidence-based programming in the way that they're intended. Also, these coalitions can help with that. And sustaining prevention funding over time using coalitions or prevention infrastructure really establishes sustainability. And again, we've heard some about that from Bob and others. If we go to the next slide, Communities That Care, click at a couple of one more time anyway. It is a tested method. It's for building community infrastructure to prevent drinking, tobacco use, delinquent behavior, and violence. It's been tested in two trials, a randomized trial with 24 communities across 7 states, as well as a whole statewide effort in Pennsylvania. Next slide. What Communities That Care does is it pulls together these diverse coalitions, gives them a common vision for where to go next. You're gonna be very active now. There's a lot of, you're gonna have like digital problems. They're gonna assess and prioritize risk protection and problem behaviors in their communities through a student survey, 6th, 8th, 10th, and 12th grade. And prioritize which ones they want to work on, and then find programs that hit those priorities, and then finally how to put the right programs in place in a way that they were meant to be put in place with high fidelity and big saturation. Next. This whole process takes about 6 to 9 months. At 1 year, people began implementing programs, and they can begin to see impact in 2 to 5 years after that on risk and protective factors, as well as outcomes during that time frame. Go to the next slide. This has been tested. Those are the states. If you use those little blocks when you were a kid, these will be very obvious to you. Washington, Oregon, Utah, Kansas, maybe they're not as obvious. Colorado, Illinois, and Maine. Okay, I remember the shapes. Some of them look the same. These communities within states were matched and then randomly assigned to experimental group to get CTC or not. Click. It's a 5-year implementation, 3-year follow-up. Click. And we've tracked about 4,400 students beginning when they were in the 5th grade, and I'm going to show you results through 12th grade today, but just really quickly. First, different communities prioritize different risk factors. Although you see the communities are along the top, 1 to 12, those are the CTC communities, the risk factors are along the side. Although there's some like low commitment to school that a lot of people did, there's a lot of places that are individually different. They wanted to attack a different risk factor, if you will. Click. They put a variety of programs in place, school-based, after-school, and parent training. And I just want you to notice a few things. At the beginning, we got about 27 programs across these 12, so it's about 2 per community. It moved to 3 per community. A little more school-based programs got in over time. It's really hard to get into schools with prevention these days because of No Child Left Behind, but community coalitions can help you do it. And the stars there are when communities began investing their own bucks in some of these programs as well. And I think that also shows more stars over time. Next. Here's a list of outcomes. And we started the Community Youth Development Study in 03 is it 06? Can you read that? 06, 7th grade, let's just say 7th grade, we started having effects on reducing risk that were targeted by these communities, as well as reducing delinquency. Click. At grade 8, delinquency or alcohol and tobacco and binge drinking joined delinquency. By grade 10, this was after 1 year, click again, 1 year post intervention when no resources were left in the community other than those that they're providing themselves from the trial. Continued to have impact, and in fact violence was added as an outcome by grade 10, and click one more time, it was maintained at grade 12. Next slide. This also shows that there is a cost benefit to prevention. Click one more time. You can see if you look at this, the total cost or the total benefit calculated using the Washington State Institute for Public Policy method is about $4,477 from a variety of different sources: criminal justice, victimization, earnings, healthcare, and property loss costs. Washington State Institute for Public Policy says, well, it's great you guys did this intervention, we're cutting your effect in half. So you can see that's only about half of it over there, 2,000 something. And so, but in either case, it's either returns $8 per dollar invested or $4 per dollar invested, depending on how much you take the developer into account. Next slide. So 2 slides left. Recommendations for states. These are, I think, the critical take-home messages. Education to agencies, professionals, and the public in this research base for prevention science. States should use surveys to assess risk protection and behavior problems of their young people and in communities, not just a state sample, but in each community. They should have a database they refer to for efficacious prevention programs and policies, and shift a paltry 10% of funds spent on children to efficacious prevention interventions. This is something for the scientists in the group. We need to increase translational research, okay, move on. I hope some of you with the NIH head will hear that. Finally, what do we do in communities to build prevention infrastructure? Multi-sector coalitions, assess, prioritize risk protection and behavior problems, match program priorities with effective programs, and support and sustain quality implementation. Thank you. One more slide that says, thank you. And there's our website if you're interested in learning more.